teams. But yeah, I'm not quite sure what it's going to be yet. I'll let you know. But so my position will be posted, and if you know any young people or peer supports who want to work with ESA, please send them their way. If you have any concerns, I can get you in touch with Tamara, but you're in good hands. And yeah, CSAC is so when I started this job, I was 23. I had just tuck enrolled out of college. And I didn't have a dining room table, and I had been eating dinner on my couch for like 5 years. At this point, speaking to you now, this time next year, I will be 27, married. I will almost have a graduate degree, and I have a dining room table. I have a really good IKEA table. It has a leaf. I eat dinner at a table. So folks, we've made it, is what I'm trying to say. I'm a much different person than I was, and going to CSAC and experiencing CSAC definitely made a big difference. And also, these meetings were one of the first places where I felt like I was doing something. And when I first started doing my job, again, I had rolled out of college and was like, I don't know what I'm doing here. I'm not even a fully formed brownie yet. I'm still soft in the middle, like, and I still think I'm mostly soft. We'll figure it out. Anyway, all this to say, CSAC has been incredible, and I hope that no matter what I do next, I might find an excuse to pop on over. But yeah, I'm excited and scared. So rad. Yeah, and thank you very much. Nakobe will pull me in. I have no doubts. And I'll come. If Nakobe asks me to do something, I will do it. So yeah, if you have any questions, I don't have any answers for you, but I can try. I'm gonna stop rambling, but
thanks, Michelle. Will you send us the posting so we can help recruit a good human for you?
Yeah, I don't know when it's gonna be posted.
Okay.
We're currently hiring a clinician, and that is gonna take a while.
Okay.
Small team.
No pressure, but I'm sure this group would have lots of great people to connect you to. So
yes, absolutely. And part of their job is to come to this. So pick someone you like. Okay. But I have every confidence in my colleagues at the Center for Excellence.
Beautiful. Thanks, Michelle. Roxanne.
Hey, everyone. I have some exciting news. We at 5CA Fifth Corner Academy, which is the nonprofit school that serves students with mental health challenges and their families. We are actually transitioning into a charter school and raising our enrollment numbers. And so we are actually going to be we're going to be partnering with Illuma to provide, we're serving students and families in rural Oregon communities who are experiencing mental health challenges and have a hard time accessing care where they are for whatever reason. And so we will be hiring, we're also going to be opening a school-based health center. And doing a virtual care, mostly virtual care, but focused virtual, same as our school. So we will do in-home visits as well, but most of it is virtual because nowadays that's, it's really what these kiddos and parents are comfortable with. And they will engage more often, even especially since we have enabled them to use avatars to cover their faces that have the blinking and facial expressions so they can still engage. It's pretty fun, actually. But so the main thing is that we're going to be hiring We do really need this is CSAC, by the way. I'm just rambling about something different. So there was something in the chat. So so we do really need a clinical supervisor, and we will for all of our peer supports. And we need a provider for probably a nurse practitioner or something of that nature. Also, it could be a naturopathic doctor. There's a lot of things that it can be. It's in statute to run the school-based health center and to be able to provide primary care in addition to the mental health services we already provide through ELUMA, and to integrate those. Yeah, I will. We're going to be starting in August, the beginning of August. Our school actually goes the beginning of August to the middle of May instead of September and June. But yes, this peer support specialist supervisor will be supervising the peer supports, but we need a clinical supervisor to supervise the peer support supervisor, if that makes sense.
Do you want to send out some links, Roxanne?
Yeah, I will.
That would be great.
Yeah,
Thank you.
and we'll be also hiring family peer supports and youth peer supports.
Awesome.
We will only start with 60 kiddos, and we're only serving high school the first year. And so we want to make sure that we are doing, as most people know, I'm really dedicated to doing the most good with the least harm. And so we want to make sure that we keep our services where we can provide the optimal services to our students and families, and not spread ourselves so thin that we're no longer able to do that. So we're kind of ramping up slowly. I want to, I'm like everybody else. I want to save the whole world, but we have to make sure we're doing it in a way that's not going to cause more harm than good. So
Smart.
Slow, unfortunately, is the way we have to go.
It's amazing. Thank you for sharing that, Roxanne.
Yes, thank you so much for letting me.
I'd like, Miranda, would you mind introducing yourself to the group? Is this your first time here?
It's my second time, my first time as an actual member. So yeah.
Well, welcome and welcome again.
Thank you. Hello, everyone. I'm Miranda. I'm a youth support specialist with Trillium Family Services in both the Valley and the metro area. I'm also a part of our IABHT team that just rolled out this year. Thank you.
Thanks for being here and thanks for introducing yourself.
Thank you.
Anyone else who's new or newer to CSAC and would like to introduce themselves? All right. Well, we have a very exciting guest today. Welcome, Anna Williams. Anna Williams is the Executive Director of Oregon's System of Care Advisory Council. And some of you might remember back in February of 2021, there was an issue brief written by CSAC, sent to the System of Care Advisory Council with an ask around how we could best be connected. And so Anna is here to talk to us about all things system of care and also speak to that. I think, Jenny, you're unmuted, and speak to some of that connecting between CSAC and System of Care Advisory Council. So welcome, Anna. We're glad you're here.
Great to be here. Thank you so much. So I just started as the Executive Director of System of Care Advisory Council on August 15th. And one of the sort of initial things that everybody was like, you've got to get into CSAC, you've got to start a conversation with them. And things were sort of tailing into the hiatus that started in November. And so didn't get here before that happened, but really excited to be here now. And even just this first few minutes, like I can tell that there's a lot going on in this group and that there's a lot of knowledge and resources, so that I'm looking forward to figuring out how we work together in a way that's really productive and beneficial, since I think we have pretty much the same goals. So I put a little PowerPoint together. I'm not sure if that feels like too formal for this space, so I'm happy to just talk and send the PowerPoint out so people can see the written version, or I can pull it up and present it. What would people, I see Jenny nodding yes. Are there other like preferences in the room? CSAC loves a PowerPoint. Okay. Okay. So basically what I did was I took the issue brief and just like cut the recommendations out of it, you know, like pasted them into the PowerPoint and then put a little like response to each one of them. So my hope is that this can be like conversational and not just me talking. And I see that Tamara's here. Are you taking notes? Because I'm going to be asking for like recommendations and suggestions. So
We actually
will-
record the meeting.
great. I'm sorry, I did see that it was being recorded. So
I'll also take some notes for you, Anna, and send those your way.
thank you so much. Okay, so I have the little green button. I'm going to share. Oh, I'm going to put this in slideshow mode first. Let's see, is this going to slideshow from beginning? Is this working for you all? Okay, so cute little blue slide, CSAC and System of Care Advisory Council. Just a quick overview of what I intend to cover today is a little bit of an introduction of myself and the legislative history of the System of Care Advisory Council, and then just really dig into that issue brief and then have some space for question and answer. Anytime you want to just talk, just go ahead and unmute and talk. You don't need to raise your hand or be called on, just say a question, whatever feels most comfortable for you. Because I can't see most of you anyway, so if you raise your hand, I would never notice. So the legislative history, as I'm sure most of you know, System of Care Advisory Council, there's been, you know, a long history of trying to figure out how we coordinate and organize the system of care in Oregon. CSAC has been a huge part of that. As far as like the origin story of system of care specifically, there was Senate Bill 1 in 2019, which created the council, and then Senate Bill 4 in 2021 gave the council the opportunity to appoint an executive director and to make recommendations on agency budgets and bills. So we're supposed to act as a central and impartial forum for policy development, funding, strategy recommendations, and planning. The official goal of the council is to approve the effectiveness and efficacy of child-serving state agencies and the continuum of care that provides services to youth, which in this case is ages 0 through 25. Obviously using system of care values and principles in all of the work that we do, which we'll dig into a little bit more later. So we currently have 3 staff, myself, Christy Hudson, whose title is System Transformation Manager, which is a lot of pressure on her, but a really lovely title that I'm excited about. Jacob Zuniga joined our team at the beginning of this month. He is Planning and Program Coordinator, and we are working to hire our final staff, which will be the Youth and Family Engagement Specialist, and that will be sort of the entire focus of their job, is looking at how are we changing systems to really engage appropriately with youth and family and see them as context experts and content experts, and not just sort of trivialize their experiences or turn them into anecdotes as we hear people who are really coming to show us how we need to improve. So when I think about our work together, my hope is that we are centering lived experience and policy and program expertise in order to work together to transform Oregon's child serving systems in the ways that we each have expertise to bring to the table. So this is copied just directly from the issue brief. It's a ton of text. It basically gives a little bit of background from CSAC forming in 2005 to advise Oregon Health Authority on using a cross-system perspective. In 2010, CSAC was given a role to oversee the statewide system of care pilot project, which turned into Wraparound, the statewide Wraparound initiative. In 2019, I mentioned already that Senate Bill 1 was passed, and CSAC indicated in this issue brief that their role kind of became unclear as far as what's the relationship between System of Care Advisory Council and CSAC. And so my hope is that we can build some clarity today and continue to work on that over time as we, as System of Care Advisory Council kind of matures into its own role. So let's dig in. The first recommendation that we received was communication. So CSAC recommended that System of Care Advisory Council provide communication pathways and regular reporting. I think in the issue brief that CC, I think that means CSAC, but if somebody knows that that is different, please let me know. That's how I've been reading it and assuming. I wasn't sure. Regarding policy development, planning, fiscal development, so funding, and system coordination, and then also evaluation of service delivery and functioning across the system of care. And does everyone know when I say system of care, like what am I even talking about? I'm assuming that people do, but I could be assuming improperly. Nat, are you seeing people like, what is she even talking about, or raising hands or anything? Okay, because I can see your face. So we are developing a listserv. 600 people have signed up for that so far. We haven't actually sent anything out yet. That is on Jacob's job description, and he is working to pull that together to sort of learn how to manage a listserv and what kind of contents would go in there. So hopefully that will be one regular reporting opportunity that we'll be sending out monthly. The sign up is there, and I'll send these slides so that you have the live link as well. We are putting together a marketing and communications plan and trying to build a new website that is sort of System of Care Advisory Council specific, that would unite local systems with the statewide system, so that we're sort of all operating on the same shared assumptions and working towards the same strategic plans. And then we do regular reports to the legislature that we're happy to also copy CSAC on if there's interest and motivation in that. And I'm not sure what other communication strategies would be helpful, but if people have suggestions or recommendations now or later, would love to hear those. Does anyone have thoughts on effective communication strategies we might put together?
This is Carol Byron in LeGrand, and I'm not sure that I have a question or a comment or what, but how, I guess my biggest question is, we are so struggling with services in Northeast Oregon, and that's what I can talk to is Baker, Wallowa, and Union counties. And I'm retired, and I'm still getting lots and lots of parents saying, I don't know how to navigate the system, including the school system. I don't know how to navigate to get help for my kids. And I really, I think the services have gone down significantly here in Union County within the last 3-4 years. I don't know, just a comment, and I'm going to put your, I'm going to write down your email there or whatever that is, a sign up, so I can sign up and get that information.
Okay.
Yeah.
Thank you. And I was trying to copy it and paste it in the chat, but
Okay.
it doesn't, I don't know how to do that. Let's see. Nope. I'll paste it in the chat whenever I'm done, so that it's there. Michelle?
Thank you.
Yeah, sure, Carol.
Hi.
Hi.
As one of the resident young people, although again, as it turns out, I'm actually getting older as it goes. My question is that, so I saw that you want a youth and family engagement. So for your messaging, I would humbly ask that you consider, how are you going to communicate to the young people whom we serve and give them the information you know? Because parents need to know how to navigate the system. I'm a big fan of parents learning how to navigate the system, because I watch my own parents kind of like feel around in the dark for it. But I always have to think about the fact that there are kids who do not have adults in their lives who are doing that navigation for them, and how can we make sure that they have the skills they need. And also, and I say this with all the love in my heart, government websites are not youth friendly.
Right.
They're not me friendly. And like, I'm a nerd. Like, this is my whole thing, is that I spend my, like, this is why I do this job. I love a good research, love a good I'm very good at the library search. So finding like finding a way to present information that is not only youth informed, but like comprehensive for 8th grade level reading. And that talks about, yeah, because if I try to put myself in the shoes of a teenager who is trying to figure out, how do I access healthcare? My parents are working. They don't have time to figure this out. I don't think I could I think if I looked at the pages as we have them now, I would just kind of give up. Yeah. I don't have a good answer for you for like, you can't like TikTok your way into hearts and minds.
Dang it.
But yeah, I haven't really seen a lot of good public health TikToks. I don't know. Maybe that should be my niche when I get my master's. It's not gonna be my niche. I can't TikTok dance. You have to be able to dance. Anyway, but yeah, reach out to the teens and the children. Maybe not the children. The children should not be trying to navigate healthcare. But the young adults and young people, because the ones that we don't see are people who don't have supportive adults in their lives, and they're at the highest risk of becoming like system involved. So
Yeah.
Yeah.
Thank you. So, and we're trying to move our website actually off of the OHA page so that we can make it a lot more navigable and user friendly, and work with an outside like branding and communications consultant who can help us with some of that stuff, but also we'll be using the youth that are involved with our system, and any other youth that, like, if you know folks that want to help, say like, I would never use that, that's stupid, I would never like look there for that thing, or you know what I mean? Like, we would be very grateful actually for folks to come tell us what won't work for them or what will work for them.
just a focus group of brutally honest teens.
Right, exactly. And feedback is love, especially when they're trying to help make us better. So we would be very open to that. I think it's a great suggestion. Thanks, Michelle. Miranda?
32/28/17.
Yeah, so I mentioned social media. I heard through Youth Era that a lot of young adults are turning to social media, specifically TikTok. I know that's kind of always a double-edged sword when it comes to that app, but I know that they're reaching out a lot on TikTok when it comes to mental health struggles and challenges. And so being able to kind of meet with them at that space where they're able to reach out and making that more comfortable, I know is really helpful. But just also being mindful of how you're doing it.
Yeah, it's always a challenge. And I think obviously it's important to be really mindful in it. One of the challenges that I personally have had is like overthinking it to the point where you're not saying much at all, that there's not like any humanity in the message, because you're like, oh, if I use that word, you know what I mean? And so sort of being very careful not to injure people, and also not too afraid to be real is sort of that like sweet spot that we'll be trying to hit. So we're working on right now a project to figure out how to communicate like what consent to care looks like to the different audiences, right? So what can young people consent to? What can they not consent to? What do their parents need to know? And thinking about how to aim that to different audiences so that youth and young adults know what their rights are, providers know what the kids' rights are, families know what their rights are. Like we need to describe those things in different ways to different people, because they're thinking about it differently and asking different questions, and they even use different language, right? And so that's a project that we're trying to figure out. How do we do that so it's consistent and also meets the needs of those different audiences? Just as one example of sort of, you can overthink that, or you can just try and then adjust. as you go. Nakobe?
Hi, Anna. I just have a really quick question. And maybe Jamie, you might want to jump in here, but about, I want to say 2 years ago, Chrissy, who is the statewide system of care trainer at Youth Era, and I held 2 like deep dive youth focus groups for system of care. It was when they had hired, I don't remember what her name was, but she was the consultant for the executive, the state executive system of care thing, and talk to young people about how they want to be engaged with communication practices, all that good stuff. I know that when I was still at Youth Era, I wrote up a pretty detailed report about it. And I think Chrissy also contributed to that report. So Jamie would probably have to be the one who answers that since I'm now at OHA. But that might be something to take a look at. It's a really great resource. And just like on the OHA end, please reach out to me around youth communication. There's also a really awesome kind of like pathway to reach out to young folks again through different youth and young adult advisory groups. I know that Michelle worked with one through ESA. Shannon Marble's not here today, but there's Healthy Transitions youth groups and a few culturally specific ones that I've been working with. So please reach out, and also know that there is a system of care kind of debrief / report that was done in 2021 by Chrissy and I, talking about just that.
Got it. Thank you. I'm sure it's in the files, and I may have even looked at it when I started, but I read so much and I don't remember all of it. So I'll dig around, and you can rest assured we will be in touch. Every time we're like, we should do blah, 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 and somebody's like, yeah, you got to talk to Nakobe about that. So you are the established expert in youth communications at OHA. Every time I talk to somebody about making sure we're doing it right, your name comes up. So I look forward to that.
Hey, Anna.
Nat?
Just wanted to clarify your question, like what other communication channels between CSAC and SOCAC would be helpful? So like things in writing or recording, or like, can you give some examples of like what the communication might be? Because it feels like people are making some really good suggestions, but I'm just wondering if you're getting the responses that you were looking for.
Thank you. I'm super open to whatever, the recommendations that are bubbling up from this group in sort of any communication direction. But yeah, if CSAC wants something specific that's going to work for CSAC, in terms of how often do you want to hear from us? What is it written? Is it video? What are those things that we can do to make sure that there's information going in both directions, right? So that we're clear on what each other is doing. That would be, really, really helpful, so that we can amplify each other's work and not necessarily be like duplicating, or sometimes we use the same words and we mean something slightly different, and that gets confusing. And so just trying to coordinate on all of that.
Mm-hmm. I think it might be helpful to like figure out the what we're going to communicate on, and then maybe figure out the how. And also, Roberta, did you throw a hand up? Sorry,
Yeah.
get it. Yeah.
Hi, I was also wanted to suggest priorities, because the priorities of your group may not necessarily be the priorities that this group has been focused on. And if we are not in alignment with the governor's plan or priorities, and there are some big issues that are not on that list that you guys have, you might need to be made aware of those so that maybe they can be bumped up on your priority list. So having that regular communication would be helpful as well.
That's excellent. And does CSAC have like a document that identifies sort of what your priorities are at this time?
No, CSAC has, we've gone through some pretty interesting shifts and changes in the last 9-ish months. And we have a bunch of bylaws that we have to go through, but people are not very excited about doing that, so I haven't pushed it. But what we have been focusing on pretty consistently is providing meaningful input and feedback to the folks that come and present on behavioral health programs that impact youth and families. So that has been the last 9 months, unless someone else would describe it a little bit differently. And but that's been the focus. And we've had lots of conversations too around what is the work of CSAC and what is the work of SOCAC, the System of Care Advisory Council, because as you pointed out, that Senate Bill 1 in 2019 sort of scooted CSAC out of the role that SOCAC is now in, right? So we were in statute, we no longer are. To Roberta's point, the governor does have very specific requests from the council. There are no specific requests from the council or from the governor. At this time, there are no reports due, there are no findings, there are no particular asks. It's an advisory council to OHA's Child and Family Behavioral Health Unit, functionally, and other folks at OHA who support youth and family work. So hopefully folks from Nakobe's team will be coming through in the next few months as well. But that would be my summary.
That is good to know. We have a strategic plan that is very dense and essentially addresses all the things. And I'll speak a little bit more about it in some of the next slides, but what we're trying to do over the course of this year is really sort of target the focus on some of the most important pieces of that strategic plan. And so we will be creating communications around what those look like, and then trying to figure out where are different councils, different organizations, where do they have expertise that we should be listening to and should be honoring? Should we be bringing folks in to speak into the council? Should we be bringing folks in to try to speak to the legislature? Sort of like, what's the appropriate way to elevate those experts? And so, you know, stay tuned, but my hope is that this is the beginning of ongoing and robust communication between our two groups. Annette?
One thought I have is that I think it would be helpful for CSAC to understand that the System of Care strategic plan, especially the elements that are most directly related to behavioral health, and for CSAC to actually have a role in kind of monitoring progress on some of that and providing feedback in an ongoing way, so that there's some structured ways that there are items that we are getting reports on from System of Care and reporting back and forth between CSAC and System of Care. You know, the other thing I'm thinking about, and I'm not sure quite how to put it together, is but some regular way to be hearing from the county. I'm with the Association of Community Mental Health Programs, and I'm aware that it probably would be very helpful for both at the level of CSAC and at the level of System of Care if there was some kind of regular reporting back and forth between these entities and the CMHPs. So as issues are identified and solutions are, that there's some more communication about that.
I'm taking notes in it, which I know Tamara's also doing, but okay, that's helpful. Thinking about how to do that. I have your contact information. I may just follow up with you. Anything else on this communication slide that's bubbling up right now? Moving over to representation, which a lot of these things are overlapping, right? So some of this communication work can be done through some of our folks being in the same spaces at the same times. So CSAC recommended that the System of Care Advisory Council ensured representation of at least one member of the statewide System Advisory Council to be a member of CSAC. I don't know if Jamie is a member of CSAC. Jamie is very involved in System of Care Advisory Council work. I think there are other folks who we can have in both places. If there's more we want to do in that space, again, please let me know what that would look like. And I think trying to make sure that we're aware of each other's work through showing up at each other's meetings is always useful. And then we can have that sort of more informal reporting communication channels as well, like human to human and not like document to document, which sometimes adds a lot more depth and nuance to the conversation.
And sorry, this is Roberta Lincoln. I'm not trying to interrupt, but one of I think my big concerns is when things are raised to the system of care group from the lowest level all the way up through the statewide. I know for me as a parent, I've been told, wow, you bring a lot of complex issues. It's too much for us to wrap our heads around. And yet parents across the state are told, go figure your own problems out because it's too complicated for the systems to figure out. And so I know I've been shut down numerous times, and I know there are other parents who are lost as well, which is why I joined a group like CSAC and why I do advocacy work. But this is yet another group of people meeting to talk about a lot of the same issues that are statewide, and nothing gets done. And yet we still have all the same barriers. So this is almost one more barrier. I mean, it's great that you guys are going to be on each other's committees and talk to one another. And the outcome is, and I don't mean to be rude about it, but the outcome is that there are people in the state, lots of people in the state who have been dealing with all the exact same issues for the past 20 to 30 years. And nothing has changed. And so when I go to different committee meetings and go and present in different places and the people there, everybody's shaking their head. Yes, I've dealt with that. That was 15 years ago, 10 years ago. I'm dealing with that today. There are 15 of us dealing with that same thing today, but all across the state, and nothing's changed in all this time. So I love that the governor is making this a priority, super. And yet I just worry with yet another layer of government involved, and still nothing gets done, and families there's nowhere they can go to get the advocacy and help that they need, because anyways, the issues are everybody's clapping in the chat and stuff. I know you said you can't see, you're not watching the chat, but I'd encourage you to look at it after the fact. So I am concerned about yet another layer. Like maybe I should get off of this committee and see about joining your committee, because I don't care whose committee I'm on, so long as enough people can hear and we can make changes and stop just talking about it for 15 years.
Yeah. I mean, I honestly, Roberta, like I agree. I've been meeting with folks who were involved in the system of care rollout. There to some extent they did local system of care work about 20 years ago, right? And we've had all of these different behavioral health initiatives and children's initiatives, and they haven't done much, right? And so my question is, if we have all these folks at the table providing recommendations, telling us what's wrong, telling us exactly what they need to see to fix it, right? Like that's not the problem. We're not struggling to get folks like you in the room. You're here, right? The legislature is motivated. I mean, I don't know if you've looked at how many bills they have around behavioral health, but like there's interest there, right? It's not that they're sort of just poo-pooing it. We have record levels of funding available. Like, so what is the problem, right? Like, why is it when it feels like we have all of these different resources that are lined up that are supposed to combine to give us the opportunity to fix what's wrong, and yet we still aren't seeing that change?
Because hospitals are turning children away and saying, we don't care for children. And really, and mental health providers and behavioral health providers. And this is a systemic issue from the health, not from families, not from the government, in that now, okay, somebody from the government's going to have to get involved because the health system won't do it. They won't do what they need to keep our children alive and safe. And so that's a really good place to start, is what, you know, a lot of the recommendations that have been brought forward to the legislature and to committees, et cetera, they've tried. And yet when you have different hospitals being governed by different places or saying, well, I know this works in all these other states, but we don't like it here in Oregon, so we're not going to do it. So parents actually have to like relinquish parental rights just to get their kids in residential treatment.
Right.
And drug your kid and take them somewhere else in the state just to get them to a hospital because your local hospital refuses to treat children who are suicidal. I mean, it's just ridiculous. So,
Right.
you know, great, you know all the issues. So let's start where the problem really is, which is with the providers and the institution, et cetera. That's my suggestion.
Thank you. I can hear that I left my tea kettle boiling downstairs. I need to just run down and turn off my stove. I'm really, really sorry. I'm just going to step away for like 2 seconds and I'll be right back. And I see you, Carol and Roxanne, but I don't want to start a fire in my house. So I'm sorry. Hold on just a second.
Safety first. This would be a good time to grab some tea or coffee or something. We can just kind of wait till Anna gets back.
Okay. Carol.
Sorry, I was struggling to find my unmute there. Roberta, thank you. I've been doing this for 40 years, and every time I see the meeting notice for doing this, I keep thinking, is it time to really get out, Carol? Because what I hear you awesome young folks saying out there is the same thing our teams were saying 40 years ago. So we can go to the legislature, we can change all these bills, we can do this, but it doesn't really happen. And it really doesn't happen in rural Oregon. Ooh, that was kind of a hard statement there, but thank you again, Roberta. You hit it on the head. Yeah.
Roxanne.
I was just going to mention that's a lot of the reason why we're doing what we're doing. So I used to love this organization called 7 Cups, and some of our young people were even in the organization, you know, providing warm line services to other young people. And I was really supportive of their work until the young people said that they left, and I said, why? And they said, because they told us if someone comes and says that they are suicidal, that what we're supposed to do is say that we can't have this conversation with them and hang up on them.
Oh,
like give them the number for the national helpline and hang up. I'm like, whoa, seriously? Yeah, that is, and because everybody is talking about, like, nobody wants to serve suicidal youth because of all of the insurance or the risk factors or whatever. But the bottom line is that these kids are dying because of those issues blocking them. So perhaps it's time to start looking at some protections in our legislative situation, so that people don't have to feel like they have to choose, you know, to protect their organization versus protect our children. That's my 2 cents.
I'm writing that down, Roxanne. So, you know, one of the challenges that I didn't talk sort of much at all about myself as a human being, but I was a social worker in rural Oregon, so Wasco, Sherman, Gillum, Wheeler, and Hood River counties. I would categorize it as sort of professional feminism, so domestic and sexual violence, food access, childcare, and the challenges around sort of building robust, accessible systems in rural Oregon was kind of my focus. And liability limitation over humanity has been a problem that I have been like railing against for a long, like it is the state's problem to solve these issues, right? There are kids in crisis today who cannot get the care they need because somebody's afraid they'll get sued if they provide treatment to somebody who has IDD and substance use disorder and a mental health disorder, right? Like, so I don't have the answer to how we fix that yet. I think the suggestion that you just made around liability protections is a good one, Roxanne. And I think we all need to call on our systems to say these kids' lives matter. And when you put your own risk of being sued in front of somebody's well-being, that's a liability to the entire state, right? So we have to sort of change the way that we're placing value on lives over money.
And unfortunately, what it comes down to is that it's going to have to be a money thing, because that's what drives our capitalist society. And so
Right.
we have to get it in legislative form that these are the priorities for the organizations and some protections so that they're not afraid to put those things first.
Yeah. Thank you. I hear that. I'll think a lot more about that. Nakobe?
Trying to figure out how to unmute myself. Just in terms of this slide, around representation, I really would be interested to hear kind of from you and then maybe other folks who have been involved with system of care, if they feel as if family voice, and I'll speak to the youth voice after that, but family member voice is like part of the like final decision-making process. Prior to working at OHA, I worked with youth and young adults and really got involved in policy through a system of care, and starting at the practice level work group and then the regional advisory council, and then eventually being the person who worked with the young adults who were on the executive committee. And so when I look at this, I'm thinking, okay, I saw more families and youth and peer supports and folks with lived experience at the practice level work group. And the further up the ladder I moved, I noticed the more removed kind of that human actual navigating experience was from what was actually going on kind of out in the world. And for me, my particular focus was youth and young adult peer support. And I would hear this from families as well, especially folks in wraparound. And I just want to hear, do you think, and do folks in the space think that the way even the decision-making ladder is structured is like conducive to the goals that we have for really including and representing youth and families? Because when I was supporting youth, I know that it was really hard for my young folks to be in that space. And I know that system of care is working really hard to actively change all the things. And I'm so glad you're here and I have so much hope. But also I really fought to kind of have that state executive system of care not feel like the Hunger Games for youth and families, where they're sharing trauma experiences, or folks who are in these really high up executive roles are asking individuals to go deeper into some of the most painful traumatic experiences without offering peer support in the space or follow-up services from folks who are really leading the big organizations doing this work that would cause, at least for the youth that I had been working with at the time, it would cause harm that would then often lead to having to access more services or really do focus peer support after. So I guess, I know I'm rambling, but my big question is, does the way that system of care kind of decision-making power structures are set up right now, is that the best structure for having youth and families and folks with lived experience driving this process? And as folks with lived experience and family members in this space, I wonder, what do you feel like would kind of bolster representation, but in a meaningful way that's not just creating a subgroup or a task force or a work group that goes on, but actually like to see those accomplishments or to see those solutions that you all have stated many times in this meeting over the years.
That felt like a question for other folks and not for me, Nakobe. Is that accurate?
Yeah, that's a question for other folks. I was just kind of like, I would be interested to kind of hear that conversation from an OHA lens. So yeah, it's a food for thought. It could be rhetorical. It could be something folks want to speak to, but just kind of putting it out there for this group's brain digestion.
Got it. Folks want to speak to that now or noodle on it and speak to it as it bubbles up?
So this is Carol again. Sorry, you guys. I have thought this over daily before I retired and since I've retired. And wow, I really don't know what the answer is, but what I really hate is that we put laws on paper or we put crisis plans on paper, and it really needs some action. And I wished I could figure this out. I wished you could hear when I meet with my friends who have retired out of this business. And we don't know what to do. And I really love hearing that there are so many young folks out there who are willing to do this. I don't know the answer. I wished I did, because I roll this over in my head every day, And I spent almost all weekend at our local hospital with a family in crisis, because even the crisis workers did not know what to do. I had to talk the crisis worker through what was available, and she has 10 years experience. So our local hospital here, they put a kid in a metal room, and I've had littles in there for up to 10 days. We can't get beds in Boise anymore because Boise doesn't take OHA. I don't really know what happened to Walla Walla and the Dows, and they kind of faded out of the system. I don't want to complain. I don't know what the answer is after doing this 40 years. And I just want to help kids still. Thanks for listening to that.
Of course. Roxanne?
I just didn't put my hand down, but I was, that's a very good point in the chat, Kara. I would really love to hear more of your thoughts about that, but I was just wanted to share in the chat that we've only served 7 full-time students this year, 30 part-time, but 7 full-time students. And we were able to intervene 3 active suicidal plans, 3 chronic suicidal ideation, which is 6 out of 7. And if you add the 1 parent, that's 100% of the families we've served this year. And I put in the chat, granted, we only serve students and families experiencing mental health challenges, but I challenge everyone to really think about the people you know in your life. How many youth and families do you know that are not, at this point, experiencing some kind of mental health challenge? Like, how many are not? I mean, it's really not about how many who are anymore, because the majority is the people who are. The minority now are the people who are not. And we really need to start changing things at the legislative, at the organization, at the systems of care levels. We really need to start opening our eyes and our ears and listening to what's going on with the feet on the ground, and not being stuck in the quagmire of what it's always been, because life is not what it's always been. Life is completely different. These young people have been inundated with knowledge past their capacity to understand since birth. Like their toys nowadays for a 2-year-old is a tablet. You know, I mean, like we as older individuals, the reason we need youth and families, you know, I'm a family representative, but the reason we need youth representatives is because we might think we know what they're going through. We might think we understand what it's like, to be inundated with that stuff your whole life. But the fact of the matter is, we will never understand what these young people are living in, because it's never happened before in the history of humankind. So if we are going to actually start making programs that actually match their needs, we first of all have to start listening and integrating what they say into the programs, into the changes, and actually doing something about it instead of placating. And we have to start talking about how the laws are protecting the wrong things. It worked before, it's not working anymore. And the programs and the systems and the policies and the procedures and the administrative rules even that the Oregon Health Authority can change, have a lot more leeway to change than the statutes. All those things, I want to just reiterate what Roberta was saying. Yeah, and what are we changing? Let's talk about that. Where's the list? What are we changing? What's different? Because whatever has happened before is not working, and something different has to happen.
Thank you. Michelle?
Okay. There's so much. First of all, Roxanne, thank you. So I'm 26 right now. I have no idea what it's like to have TikTok. So when I think a lot of us forget, Instagram was not around until 2012. It feels like it's been around forever. It was not. When I was the first generation to grow up with that kind of social media, like ongoing influence. And I remember when I was in the mental hospital having somebody be like, hey, you are not an Instagram candidate. You gotta get out. So I appreciate that, Roxanne, because I, even as someone who is relatively young, cannot tell you exactly what it's like. So when I think about everything I've learned in school about health systems, something that really bothers me is that the way that the system has been designed and the way that we do funding, I cannot see how this would not be what happened. Like, we pay people who do this kind of care work, like, not livable wages. We don't invest in that. So as they retire, people aren't taking those jobs. So we have a workforce shortage of counselors, teachers, adults in kids' lives who aren't their parents who care for them. We have a shortage of that in Oregon. And then the question is always like, oh, well, is there more mental illness now than there was before? I actually don't think so. I've found no evidence for that. I think people talk about it more, but I actually think that one of the things as a society, not to speak too grandly, is that we have this passive acceptance that adolescence is not good and it's not fun. I don't know how much of that we should be accepting, because being a teen is hard. Like, the fact that you just, like, your legs grow, wild. The fact that you're an adult with the brain of a child, wild. Teens, wild phenomenon. But the fact that the amount of people I know, myself included, who had pretty high levels of distress as an adolescent, and everyone was like, that's how it is. Adolescence is not fun. Between the developmental phase that young people are in, so they're not children, but they're also not, like, fully developed yet. So all of those stressors, adverse childhood experiences, all those stressors are going to affect their developing nervous system more than they would an adult. And then you put them in a period of life transition. They're going to be adults. They don't have an option. They're going to be an adult. They're going to fall off that cliff. If that transition doesn't go well, we know that they tend to fall through the cracks when they transition to the adult system. And there's just not good support for them after that point. Then you see your parents are stressed because they don't know what to do with you. I mean, I vividly remember my mom breaking down making soup one time because she just did not know what they were going to do for me. And I didn't want to fail them. I needed help, but I felt like I was failing them because I couldn't figure out how to get my stuff together. Now, luckily, I grew up in Chicago where you throw a rock and hit a hospital, so I was fine. But it is still, when I think about, like, oh, what has to happen with the system, the United States hasn't ratified the UN rights of the child. Like we see children as like a fundamental class of people that's different than adults. And to a certain extent, yes, everything's more. But they still have like base human rights, and the idea that you could just like turn a kid away from a hospital because like, well, pediatrics is complicated. It is, but like, so is geriatrics. I don't know. I think in terms of like, oh, what actual systemic change needs to happen for us to be like heard? The way we've set this up, we've siloed kids into one system. We don't fund the kinds of like careers that help children. Parents do all the navigation. We don't really have like a robust social net or social. I don't really see how this couldn't have happened. And then we also don't treat adolescents or teens with the kind of autonomy to like make decisions for themselves sometimes. And while they are still children, they can't navigate the system. So when they become adults and they're on their own, they have no experience. And it's no wonder that so many people, particularly because in terms of like mental illness, late teens, early 20s, it's our time to shine. When I was at Reed and I was doing public health programming, I always said this, our time to shine. Big life transition, late teens, early 20s, our time to shine. High school, middle school to high school, 14, our time to shine. I don't know. I'm rambling, but what I'm saying is that we have made fundamental underinvestments in the kind of workforce that you need to make this kind of change. That means that that work goes to parents, which does directly affect children. What happens to their parents affects children. If they have parents who are able to do anything, if you've got parents who are both working 2 jobs in order to get by, this is not even on their agenda. Like they just, if your baseline is survival. I saw in the chat, and we talk about this all the time at OHSU, being able to speak English as your primary language gives you a huge leg up in these systems. And for the vast majority of parents, that's not true. And then if I think about a population that gets a lot of services, it's young adults who are in juvenile detention. Mm-hmm. For some kids, that is how they get help. And we know that that distribution of children, I'm saying the majority of kids in those cares, they're not white. So, like, those children kids who don't get help end up somewhere. And depending on like layers of society, we decide where they go. Kids like me get private health care. There's nothing uniquely deserving about me as a child. I was just a kid. So to end my rant, what I would want is that improve staffing, like invest in these carers. Some of the most important jobs, but we expect them to do it out of the goodness of their hearts, which most of them do. However, there's not enough of them. I see, I'm a nurse too. I never want to speak about what nurses need. Ask the nurses and just do it. That's my thing. Like, did you ask them? Did you ask them? That's my thing. I don't know. And then in terms of like systems, recognize that any help that you give parents directly affects children. But that there was so much about kids. Like there's so many teens out there who we don't see, who aren't in 2-parent homes, who aren't speaking English, who no matter what we do, if we don't think about them, they will get left behind. And then in 10 or 15 years, we'll be talking about how certain kids did get help, but then we'll still have a whole population who we didn't even touch. And that's not cool. Anyway, yeah, I think that's my rant. The problem is that you got me. I had a class yesterday, and you never want to talk to me after I have class because they tell me
a million things going through your mind.
You never want to talk to me after I go to public health school. You just don't, because then I'm like the system, fundamental causes of health inequities. I'm just like screaming in the background. I'm like, you know about the correlation between zip code and life expectancy? Because that's wild. So thank you for listening. I'm gonna be quiet now.
Thanks, Michelle. Nat?
I am feeling called to sort of interrupt for a moment and kind of call us back into the original hope and request that Anna came here today. And I want to acknowledge all of the feeling and passion that I'm hearing and seeing, and also want to speak to system of care came to be in the 1980s because of these same issues. Things are not better enough and they have not changed enough for us not to have system of care. And so system of care came together because there was not a single door. for people to go enter through and get the support they needed, right? And so as somebody who's been doing system of care work in the state for a while, the opportunity to have CSAC and SOCAC connect really intentionally and to really join forces is a really strategic and exciting new constellation for CSAC and for SOCAC and for Oregon, honestly, because the council is being paid attention to in much bigger ways because of the governor, because of Senate Bill 1 and what it was called out to do. So I'm wondering if it's okay if we shift the conversation back to what system of care is doing in Oregon, or what the council is doing for Oregon right now, what the focuses are, and if we can then find ways for CSAC to say, yes, this is how we would like to be involved, and this is what we would like to do. I think we are all here because we want to see change. I'm inviting us to sort of shift the way that we're going about talking about it, because I think there's a lot of really good opportunity here to strategize. And so if that's okay, I would like to shift gears towards that. I mean, it's up to you, Anna, but I'm just feeling like we came here to learn more about what the council's doing because CSAC asked to be connected. So I just want to give some space to that.
I hear that. I appreciate that, Nat. Like I said, I'm really open. Like I feel the passion in the room. I know there's a lot of frustration around the pace of change and the lack thereof. And you know, I don't disagree that people are frustrated, right? That especially folks who have been pushing and not seeing things turn to the extent that we want to. So my hope is that I can be an ally in that change work and use the position that System of Care Advisory Council has within the structures to push this work faster, right? So I mentioned earlier to, and I'm not trying to divert, but here's the link to sign up for the listserv. And then here is the link to see all of the legislation that we're tracking. And we will be reaching out to folks who want to testify, provide lived experience information to the legislature so that they can really understand how this work is affecting your lives and the people that you work with and the people that you serve. There's a lot more work for us to do within that spreadsheet, but those are the bills that we're watching, and some of those bills we will be endorsing. Some of them do relate to a lot of the topics that were raised today. And here's my last link, which I will post, which is the data dashboard. One of the recommendations that I had in the PowerPoint was data informed. And so this is you can get into the dashboard if you want to set up a conversation with one of us to help you navigate how you use it. But you can look at what is the rate of racial representation within the juvenile justice system, for instance, connected to what Michelle said earlier. What are the overrepresentations within the intellectual developmental disability space in terms of who's getting diagnosed and who's getting criminalized, right? Like these are problems that we know about. We can look at them county by county or CCO region by CCO region and think about where we are, where we have the power within our local relationships to start asking hard questions, to be elevating these things through your local system of care, through your local county juvenile directors, like whatever that advocacy avenue is that's going to be effective. And in another of my previous lives, I was a social welfare policy instructor, and community-based participatory decision-making, program design, and budget development are things that I am passionate about. So if you want me to come talk to your organization about ways that you all can engage folks on legislation so that we can raise the rates for folks who are doing this work, so that we can pay off people's student loans if they want to work with the communities where they already know, right? We know people have to move to cities a lot of the times to get the degrees that they need in order to provide the services their communities need. And it's hard sometimes to move back to rural Oregon and provide the care to your home community. You may not be able to afford to buy housing after you've got a student loan in order to get the skill set you need, right? And so there's all these sort of overlapping interlocking barriers to really the access to the system that we want to see. So if there are things that system of care can do to help you elevate your voice, or elevate the voices of the folks that you're working with, or that you sit with day to day, like I would love to be a resource in that way. So, I mean, if you want me to go back to the PowerPoint, I'm really happy to, but I think what Nat's question was like, what are we really working on, right? So, working on youth and family engagement as our top priority for 2023. So what does that look like? Going back to Nakobe's recommendations and Chrissy's recommendations, right? Hiring a person whose sole job it is to not teach youth and family how to engage properly, but teach systems how to be engaged, right? How to show up, how to hear. Maybe we have to think about different kinds of meetings and different timings of meetings, right? We need to show up at the tables where other people are already having those conversations, and not keep saying, can you come and represent your whole community with one voice, right? Because there is no one voice that represents an entire community. So building those more sustainable dynamic relationships, instead of just saying, you need to come articulate this to me perfectly so that policymakers can understand what you're saying well enough that they can then turn around and act. So youth and family engagement is the absolutely top priority. I'm sorry, Roberta, I see your big comment. I'll read it later, but I can't read it now, or I won't be able to say anything else. Systems collaboration and coordination, right? Like when we're sitting in that state agency standing committee meeting, which happens where it's DHS, the Department of Human Services, and the Oregon Health Authority and the Oregon Youth Authority, and the who's the OIA, OHA, DHS. Who am I missing? There's one more. ODE, Department of Ed. That the call from System of Care Advisory Council is that all of these problems are all of our problems. It's not okay to shuffle them off our desk and say, well, that's an OHA problem because that's in Medicaid rule, or, oh, well, that's a DHS problem because that relates to kids who are wards of the state, right? Like every single one of these kids is walking through multiple systems, or should be walking through multiple systems if access was working properly where they could get the care that they needed. Every single one of these families is our problem until we're not continuing to see, oh, well, when we asked for this thing, we didn't get it because we didn't use the right secret password to let somebody know that we were eligible in the right way, right? So I'm hearing you. I want to be your ally. I don't want you to feel as frustrated as you do, and the passion is really useful to keep pushing progress forward. Jenny, I heard you unmute just for a sec. Did you want to say something?
Oh, no, that was an accident. But I do just want to back up what Roberta was saying. Like on the Reach Out Oregon Warm Line, we get calls every day from parents who are in beyond desperate situations with their children with no support or help available to them.
Yeah, and it's heartbreaking. And it's not okay, in 5 years we'll solve this problem, right? It's an urgent crisis now. Sorry, who was talking?
Me, Connie. Same like Jenny, I work in the warm line, and I hear the sad stories every single day, and more challenges in my community that the parents, their first language is not English. How we navigate. I don't have idea how many challenges every day we like a parents, more when people ignore us because don't speak well English. And I hear that every day with parents, and really broken my heart. I'm agree with everyone. We need action. Action we need, because this has happened for years and years. And I can't believe we are in USA, right? Supposed to be the first, I can say that word, but it's so sad to hear stories every day, and more challenge in that small communities, and more with Black community and Hispanic community and other communities. How hard and difficult for us. We need action. Really, we need action. Thank you. And I'm sorry, I feel like my broken heart is, my heart is broken. and every day when I hear that stories.
You don't need to apologize to me. Thank you for speaking up. And I'm sorry too. Is there other comments or feedback? I feel like there's like so much to say in response. I don't want to dismiss what's already been said by just moving on to other things.
I guess I put it in the chat, but just to say, as far then thinking about what Connie just shared, and our first couple items you were talking about communication and representation. So ideas would then to be it, and I know it's been offered in the past, but having interpreters at various meetings or getting out. Sorry, completely blanks. Having documents in different languages so that, as we recruit maybe, hopefully, and get people, kind of pulled in, it'd be just nice to have. And maybe it's there and I'm just missing it, but it's just always being sure that we have that.
It's not there to the level that it really should be, Christy. There's the translation through the Oregon Health Authority's Office of Equity and Inclusion, and you can get people to come in to different meetings and provide that interpretation services or translation services, but that's one division within one state agency. It's not, we don't have that access for, when I think about what I want to see for system of care, I want everyone in our state to have access to resources that promote wellness, right? So we don't have interpretation services like at the Department of State Lands, so that folks who don't speak English as their first language can actually engage in like, how would we like to see our public lands managed so that our environmental health is protected, so that our kids can play outside in the same ways, right? Like that's a system-wide transformation effort that hasn't gone far enough yet. So like there's always maybe there won't always be progress to be made. Maybe in 10 years we'll turn around and be like, we all did it, guys. But right now there's so much progress to be made that there are all sorts of different places to push on that, like American Sign Language and other types of sign language interpretation, right? There's so many different ways to be thinking about access, and we don't have all those resources in place within the System of Care Advisory Council or across the state agencies at this point.
Well, and I even mean more specifically for this meeting, or, as we communicate and as we work together, I'm just thinking if we wanted to, invite a provider who's only Spanish speaking, and we have Spanish speakers who are bilingual, but yeah, I'm just even thinking specifically for the work, where we're at.
Got it. Lisa?
Hi, everyone. I guess I'm kind of echoing what Christy had just mentioned. I've been involved with the system of care and with Office N for